I have a doctor who looks at me instead of my mother when she talks to me. I like her.
I like it when doctors and nurses let me talk for myself. It helps me know I am independent.
I get nervous at the doctors, and if my mom does not tell them how I feel, I don't say anything.
The easy part is following directions like go pee in a cup. The hard part is understanding what some of their doctor works mean.
Throughout my daughter's life, I have selected healthcare providers who are familiar with autism spectrum disorder and who could provide her with stress-free care.
Health literacy to me would be a very complicated question, I think. I think health literacy is understanding the ins and outs of what it means to be healthy or sick and to receive care, to maintain health or to treat illness.
I'm Emily Colson, and I have this beautiful, amazing son, Max. He's 26 years old. He is a ball of energy, and being healthy is really key in our home. Max has a lot of challenges with autism, and so we need to do whatever we can, diet, exercise, medical care, to make sure he is physically in tip-top shape.
I stay healthy by making sure I eat healthy, making sure I eat healthy, or various things like that, like swimming, or, when it's appropriate.
To be healthy, I exercise more. I am an athlete. This is what I do. It's basketball, flag football, and softball.
Really just means healthy food, and based on what you put in your body, you should always put good stuff in your body.
The key thing is you gotta have an annual checkup to keep an eye on it, keep an eye on your health, and take your medication when it's prescribed.
Anybody that takes care of me, I say what I need, and I am very responsible for my own needs and my own care.
I'm a physician because I'm supposed to help people. That's the way I have felt about things for a long time. So it's something I have to do. And I think if it were any other way, I couldn't do it.
Most doctors truly care about their patients. When someone with a disability walks in the door, we have to give a little extra attention. But what happens in that, when relationships are built, the physician finds out how amazing that individual is, that they are more than just the disability, they are more than the illness, they are remarkable people. That's the key. That starts it all.
Care in general, just because somebody has a disability, doesn't mean that I treat them any differently than I do anybody else. Whether it's needing mammograms and pap smears for women, needing colonoscopies, needing immunizations, and so on. I mean, these are important preventive medicine that needs to be, people should be received, or should have the options to.
My doctor is just a very nice man. He's, as I explained to you earlier, he's got open arms. He said he told us a couple of years ago that as long as I wanted to continue coming to him, he'll see me. So I think that's just incredible.
What I really like in a patient or a caregiver is an active engagement in their own health, You know, they want to understand what's going on. And then an open-minded feeling towards their, in my case, physician.
I would prefer to go to a specialist that specializes in my disability, because they know a lot more, and they are very caring about it, and then they are very helpful.
It's always amazing to me to just go and sit in my own waiting room, which I've done probably more than a lot of people, and say, what would it be like if I had a disability to be here? If I were in a wheelchair, how could I maneuver my way around? Where would it, really be thinking about that? Accessibility to the counter is at a level where somebody could easily interact with you, whether you're in a wheelchair or using a walker or some other assisted device to help them out.
For instance, if I was to have like open area and like not such tight areas, and have a lot of things accessible, that would be great. There was a situation where I had to go in for a thing I had to do, and it wasn't accessible to me, so I had to go somewhere else. I don't want to have to go all the way to Boston to get my care. I was told that I could go all the way to Boston, but I want there to be accessible rooms and accessible stuff, so we can get the care that we need and want.
I always look for ways to make it simpler for people, where they don't have to wait, where there's not going to be a crowd, but yet still providing the care that they deserve and that I want to provide to them in order to have a really quality approach to what I do and for them to have a happy life.
A lot of people don't know that I can speak for myself, and if you want to ask me a question, you ask me. You don't ask the person that comes with me. It makes me feel like I'm not a person. And I am a person with thoughts, and I have my own thinking ability, and I can answer whatever they have to ask me.
And even though oftentimes I'm getting the history from a caregiver, I'll look at and ask the patient the questions, and the caregiver is giving the answers, and I'm listening to them. And sometimes I'll say to the patient, "Do they have it right?"
I would always tell Max to speak up when something doesn't feel right in his body. He isn't able to communicate the way you and I can communicate, but I'm often asking him, "Max, point to what hurts," that it's okay to talk about something that doesn't feel right in his body.
Also, be aware when somebody can't speak to you, don't shun them. Make sure they know you can understand them, because if they talk with a board or talk with any other machine or anything, they need to know that you're listening, no matter what it is that you have. If you can't use your voice, or they need to know that you're listening to them and that you're getting the care that they need.
We have one particular hospital that does an autism care plan where I can fill out information about Max. Really, it's a great idea for us as family members to carry something like that with us when we go into a physician. We can list out what upsets a child, what helps a child, how to speak to a child. Do we use a soft voice or a stronger voice? Do they respond to someone who's energetic or someone who's more passive? We can bring something like that with us when we start with a new doctor. They'll be thrilled to get something like that. That will help them care for their patient, and it will help us start off on the right foot in care.
I keep relatively comprehensive notes. And one of the values of the electronic health record is I've been able to sort of roll my note over, and I have my checklist when they're coming in to say, oh, this person has X, Y, and Z that I want to ask about, and I want to remember to monitor, because the patient's not going to say, oh, I'm here for my asthma, I need a refill. The person that's with them may not know that either. So I take that on, and people always say, you have such beautiful notes, Dr. Baldor, and I say, well, yeah, they're necessary, you know. But that's a key piece to do that. The other key piece is when I first see somebody, I always want to know who's the best contact to understand what's going on with them. And sometimes it's a family member, sometimes it's an agency nurse, sometimes it's an agency manager or somebody. I want to know who they are, and I want their phone number.
So here's what I want people to know, is that someone like Max is really precious. He's a really amazing guy. And he deserves the best health care. He deserves the best people around him. As a parent, we have to advocate for our kids. No one else is going to be there doing it. And when we do that, we give more opportunities to other individuals who come behind them, because we have the opportunity to teach doctors, right? To equip doctors in how to serve our loved ones with disabilities. That's going to make an impact for everyone with disabilities. I'm excited about this project because I think it's going to start a conversation about how we care for someone with autism, for example, who can't communicate that well. How do we do that? How do we do that as caregivers? How do we do that as physicians? And how does someone self-advocate and express their own needs? So I hope some great conversations will come from this.